Okay, so we're going to move on to other bleeding problems. So let's start out with Steve, a 72-year-old male. Presents with fatigue, abdominal/back pain, hypertension, difficulty swallowing, and dyspnea. Okay, let me think about this. This guy's pretty old. He's tired. Okay, duh. Abdominal, back pain. He is 72. Kind of keep that in the back of my head, though. Hypertension, never a good thing in anybody. Difficulty swallowing. Okay, he is 72. Dyspnea, difficulty breathing. Okay, so each one of these things is not unusual at all in a 72-year-old person. However, putting them all together, that really doesn't give me a great clinical sign, a great clinical picture of this guy. So let's look. He has a history of chronic hypertension and smoking. Okay. Tests performed were an abdominal ultrasound, blood panel, and an MRI. Good idea. Blood glucose was normal. No signs of CRP, which is C-reactive protein, which indicates inflammation. That's something. Troponin was not present, which means he's not having a heart attack. That's good. The results of the ultrasound showed a fusiform circumferential mass. Well, stinking radiologists are always using words like that. What is Steve's diagnosis here? Start with, the only thing I really need to know on here is that abdominal ultrasound showed a fusiform circumferential mass. Fusiform is kind of like that shape. It's not, it's like an oval. Okay, but he's got a mass in his abdomen. I'm going to need a little more specifics on exactly where that is, because that might not be, well, either way, it's not a good thing, any kind of mass, but that specifically says something to me. Does it say anything to you guys? Any idea? No? Okay. What we have here, in this case, happens to be, and I'm going to show you actually right there. Okay? AAA, abdominal aortic aneurysm. Okay? See that fusiform circumferential mass? Right here? That sucker's huge, by the way. It's as big as the kidneys. Okay? Fusiform circumferential mass. That's the abdominal aorta. Okay? That's still the aorta. That is a huge pipe carrying a ton of blood. Okay? In that case study, if you think about it, there were some clues like high blood pressure. Okay? High blood pressure, that is one of the problems, is it can blow things out. It can cause aneurysms. Okay? Aneurysms, depending on where they are, can be, well, they're never good. Okay? Your artery's puffing out. Okay? If that artery puffs out, it's probably going to press on something, no matter where it is, and cause some pain. If that artery blows, depending on the size of the artery and where it is, you may have only minutes to live. Okay? That AAA is one of those examples where if that artery blows, you're in big, big trouble. Okay? Because that is just a ridiculous amount of your blood. It's going to bleed in your abdominal cavity. That's going to fill up, and you know, we're talking minutes here. Sometimes they will dissect, not all the way, give you a little more time, but the death rate on this is pretty high if they completely dissect. Okay, so we're going to look at just a couple different aneurysms, the Berry aneurysm and obviously the AAA. Berry aneurysm, if you remember from your anatomy, if you flip that brain upside down, you see that in the lower right-hand corner, that whole circle of Willis thing, right? Well, a Berry aneurysm tends to pop up. I guess that's kind of a pun, not on purpose, but Berry aneurysm tends to pop up right about where things are splitting off. Okay? So, I mean, if you're looking, you have your your carotid arteries heading that way, and then if I remember right, that's the basilar artery. Is that right? And then that basilar artery kind of splits off and goes into the circle of Willis. Well, right where it splits off is where you tend to see, if you're going to have a aneurysm, that's a really good place for it to be, because kind of the flow is kind of hitting that and splitting, and you have some pressure there. Anyway, that is one of those things that happens. Okay. If it doesn't blow, it might cause some pain just because it might be pressing on some nerves, or it might not. Okay. Hypertension, like I said, is associated with pretty much every aneurysm. Okay. An aneurysm is simply a weak spot in the artery, in the arterial wall. Okay, and that can be sometimes genetic. Smoking definitely increases the chances of that happening. Okay, again, cigarettes, 4,000 plus chemicals in them. Something or some combination of those is known to cause weaknesses in arterial walls. Okay, smoking causes little chips and dents in arterial walls. That's why it's highly associated with plaque buildups and that sort of thing too. And again, sometimes it's just genetic. Okay. The abdominal aortic aneurysm, same thing. You can throw Marfan syndrome in there for any kind of arterial issues. Does anybody know what Marfan is? Marfan syndrome? Anybody want to talk about what Marfan syndrome is that knows? Okay. Briefly, it is a connective tissue disorder, which makes everything kind of stretchy. Okay. They say that President Lincoln had Marfan's because you do tend to be taller and really long, spidery fingers. Okay. That's some of the outward signs. Inwardly, you have collagen issues, elastin issues, and you're really stretchy, and that's fine. That's pretty awesome, for entertaining friends when you can take your thumb and bend it back all the way. Not so much though when you're talking about heart muscles, heart walls, vascular system being stretchier than it should be, because that does cause a tendency to have aneurysms. Okay. So that's one of those genetic things that just happens to be associated with this. Okay. The signs and symptoms should all be related to the condition. In this case, especially if you think about it, if your problem is in the brain and you have an aneurysm popping up, it might cause a headache, right? It might cause eye pain depending on where that aneurysm is, visual changes, numbness. You think about that optic nerves, right? They go all the way from the back of the head all the way to the front of the head. That is a lot of ground to cover, and if anything happens in between there, it can affect the vision, right? That's why you see visual changes in a lot of things that cause any kind of increased intracranial pressure or any kind of arterial bulge pressing anywhere along that. It can cause visual changes. Again, weakness, if you're hitting any kind of nerve on the way. Increased ICP means what I just said, increased intracranial pressure inside the head. Yeah?
You said for the Berry Aneurysm, what causes age? Is that old age or?
Old age, yes. Sadly, for every pathology, one of the causes is age. Older you get, the more things break. Huh?
It's possible for a young kid to
It is. Sorry. It is possible. Yeah, it's possible for anybody to get anything, really. But it's a lot less likely that somebody young is going to get any kind of an aneurysm. Yes, there are some genetic things like Marfan's, for example, that might cause something like that to happen. but pretty unusual on the grand scale of things. Why, do you happen to have a story here, or is you just asking?
Yeah, my mom's cousin's child was like 6 or something, and he had like a really, really bad headache. He had headaches and stuff, and finally had like a really, really bad one. She was driving him to the hospital, and he died in the car on the way in there.
Oh my gosh, I'm so sorry. So he's 6?
I think he was like around 6 or
So your mom's cousin's child.
so technically my cousin.
Okay. 6 years old, had an aneurysm blow.
It's crazy.
That is crazy. You just don't see that often in kids. There had to be some kind of, that's probably what we're talking about on that up at the top where it says the AV malformation, arteriovenous malformation. He may have just had one of those, okay? Having an arteriovenous malformation isn't unusual. However, having one inside the brain, as you know, can be a major problem. Okay, I actually have a little one right here in the center of my chest. It's called a hemangioma, where basically the arteries and the veins don't match up like they should with that whole, you go from an artery to an arteriole to a capillary to the venous capillary, right?
How'd you find that out?
How do I find what out?
That you had that?
I can see it. It's a little stupid red bulge. It's like
it
right
sticks
there.
out.
Yeah, it sticks out. It's kind of hideous looking, actually.
Can maybe trauma related, like say in a 6-year-old, that like if they
Could
had
it?
some sort of fall, like
Sure, of course. You could have, yeah, absolutely. You could have an aneurysm that was there, and then like a little fall might pop it or something. Typically, when you're having intracranial bleeds, though, especially in kids or anybody really, is from trauma. It's more like a a hematoma of some kind. But yeah, that can happen, and at that age, I would guess it would be like a arteriovenous malformation, just a fluke, unless of course you happen to know that there's some kind of genetic thing going on in that side of the family that that happens. But yeah, that's too bad. One thing that you said, remember this, guys. This is kind of important because you are going to see aneurysms, okay, in the brain, okay. One thing she said is he said he was complaining of a headache, right? A lot of times the phrase you will actually hear is, "It is the worst headache of my life." For whatever reason, well, probably because it's true, people say that. I'm having the worst headache of my life. Well, of course you are. You're having an internal bleed in your brain. Reminds me of a story, right? Again, my daughter's in the last semester of nursing school right now. Well, when she was in her first semester of nursing school, there were some students, GCU students, that they were in their last semester of nursing school at one of the local hospitals, and they had a patient come in. "I'm having the worst headache of my life," right? Immediately, they recognized that. Next thing you know, he's getting an MRI. But in the meantime, while they're sending him out for everything, they're still questioning him. Well, it turns out that like 4 days before that, he went to one of the other local hospitals in the valley and said the same thing. "I'm having the worst headache of my life." Well, apparently this guy looked, let's just say, not very professional, right? So that first hospital, they kind of thought, oh, he's a drug seeker, right? Gave him some ibuprofen and sent him home, okay? A couple days later, he goes to another hospital in the valley. "I'm having the worst headache of my life." And they pretty much had the same reaction, They're like, "Yeah, you'll be fine. Suck it up, dude." Give him a little bit of, fluid, ibuprofen, sent him home, okay? It wasn't this hospital that he finally came to where they actually started to do the MRI or CT. I don't remember which one they did, but they have him in the machine and he died, right? This isn't something that you can ignore. When they say that, big old red flag should jump up, okay? Yeah, they might know that and be a drug seeker, but you know what? We're not the police, right? We're healthcare providers. That's not, that's up to them.
Can you just do a drug test and see, like, oh, they haven't been on drugs or something?
You could, but
I feel like when it's
that doesn't mean just because you're on drugs that you don't have an aneurysm bleeding in your brain, right?
When it's risking someone's life, why does it even matter at that point? Why
Well,
would you
it's
try to-
expensive as heck, and the reality is that an MRI is $1,000, right? If you gave everybody that walked in an MRI, your hospital would go under in about a minute because, again, whether it's right or not, people absolutely judge and profile. This guy looked like he was homeless, like he was a drug seeker, and they're like, we're not wasting our money. 2 out of 3 hospitals went with that plan, and the guy died, right? Most of the time, they're probably right. Unfortunately, sometimes you're not, and you end up killing somebody. Well, not killing them, but letting them die under your care. So let's keep that in mind. That's one of those phrases where, yeah, they actually say that. It's the worst headache of my life. Okay? Anyway, if you notice the abdominal aorta part on this, I pretty much threw most of those in on that case study, okay, as far as the typical signs and symptoms you would expect. Anxiety, you're going to get that in any of these. Somewhere deep down, they are freaking out because they know something is seriously wrong. You guys know how your body feels, right? They know something's seriously wrong, and they're freaking out about it. They might think they're having a heart attack. You're like, oh, your EKG's fine. You're not having a heart attack. Okay, but is the internal bleeding, right? That's where you do really quick physical exams. If that abdomen is stiff and swollen and hot, you might have some serious internal bleeding going on there, and they could drop on you any second. Okay? So here is a picture of, obviously this person did not make it, a punctured Berry aneurysm. And of course the AAA that we saw earlier. And if you wanted to look at it on some scans, it's and the one on the left, it's that little thing down here in the middle, right? Right in the center. And you got that little pouch, it looks like. That may be the aneurysm popping up. Okay. On the right, obviously, you can see where you have 2 different layers of the same vessel with different colors. That's really, really huge where the arrow's at. What is that?
Full artery?
Yeah, if like this is the artery, then that would be like the popping out of the artery. Okay, keep in mind when you're looking at these scans, they're slicing you like if you're laying on a table, and they're like chopping like straight up and down. Okay, if you're laying flat, and they usually go from the feet up, so things might look backwards to you. But yeah, it's just a slice, and at that particular slice, you can see that there are a couple of different layers to that same vessel. Okay, again, you open that thing up, and what you got there is a bomb. That is a time bomb. It's waiting to go. Questions on that? Yes?
Where's the treatment, please?
What is the treatment for it? All right, let me see if I can draw this. There's a couple of different ways you can go around, obviously surgical. But basically, let me go back to a different slide. It's probably easier to draw. Okay, so basically what you want to do is you want it to look normal like that, right? So what you would do is you would cut into their thigh and run a stent up in there on the inside, and then once it gets in the middle, you pop it open, and it's like a little metal mesh net that kind of does that and takes all the pressure off that. So if you hear somebody had a stent, that's what they're doing, is they're kind of like taking it from like their thigh or their hip, putting it all the way up that artery to where it needs to be, and then they're popping it open. And it takes the pressure off it and puts it on the stent instead. Okay? Does that make sense?
Yeah.
So yeah, that's what they try to do, if you can.
What if it's in the brain?
That's a problem. If it's in the brain, you try to keep your blood pressure. Well, no matter where it is, you try to keep your blood pressure down. If it's in the brain, that is a really good question, because I don't actually know what they do inside the brain, especially if it's like a Berry Aneurysm. How in the heck they get to that, I don't know. I'd have to look that up. Ideally, you could put some kind of stent in there, but I don't know if you can, honestly, considering where it's at. You got to get, those are some major arteries, and you can't bleed much in the brain. And whether you can get to it or not, I really don't know. Okay? So,